Nowadays, we live in a complicated society. With many different organisations, rules and regulations, it's often difficult to establish if they are there to help or hinder you as you go about your everyday life. In the cases of health and social care, it can be a frustrating process if you feel improvements can be made, but you either don't know who to talk to, or you feel that your voice won't be heard.
Norfolk Link is one of a number of local involvement networks across the country. Links are supported by the government, but they remain independent and are run by volunteers who help give their local communities a stronger voice in how health and social care services are planned and delivered in the area. Norfolk Link not only needs the support and views of its volunteers, but it also requires the people of Norfolk to tell them what they feel about the services and any concerns they may have. Hi Maggie, nice to meet you. You okay?
Yeah, I'm good. You?
Yeah, I'm good, thank you. So Maggie, can you tell me a bit about Norfolk Link membership?
Yeah. There are two types of membership. Firstly, individual members like myself who want to make a positive difference to health and social care services, and then organisational members, which include voluntary and community organisations such as Norfolk Coalition of Disabled People, Norwich and Norfolk Racial Equality Council, Age Concern Norfolk, Norwich Mind and Action for Blind People.
With the help of hundreds of members from across Norfolk, Norfolk Link constantly watches, listens and helps to monitor what social care and health services are doing. Issues and areas of good practice can be highlighted to Norfolk Link by anyone who uses the services.
Norfolk Link can take matters to the highest levels and represent the people of the county. Essentially, Norfolk Link gives local communities the chance to get directly involved in how these services are planned and delivered. It provides a vital bridge between the people using and needing healthcare and social services and the organisations that provide them. So we can see that Norfolk Link is a link between the user, carer or family of social care and health services and those often large organisations who are actually responsible for the quality of the services. Norfolk Link gives you, the people of Norfolk, a strong and effective voice to raise concerns, give positive feedback and suggest improvements to key organisations. Let's go and see Norfolk Link in action, meet some of its members and find out what a difference they have already made.
You don't have to be ill or disabled to benefit or contribute to Norfolk Link. Carly is a young mother and decided she wanted to have a voice as far as maternity care is offered.
When I heard about Norfolk Link, it seemed like a really positive way to get involved with the changes, basically influence on the NHS. I am really enjoying actually. I'm learning a lot more about the NHS and the involvement. I recently did the induction training where I got to learn about all the groups that were going on and all the issues that were being raised with the NHS and how the NHS deals with these issues. Well, I've recently obviously just been through the maternity system myself and seen the problems that arose and the things I liked and I didn't like. Not only do you get to we'll learn about the rest of Link, there's so many working groups that are set up so it doesn't have to be, whereas my interest in maternity, there's loads of different groups to get into what you're interested in. It's a really positive way, much better than sitting at home and complaining about things when you can actually get involved and make a difference.
So, Carly has talked about her own personal reasons for getting involved with Norfolk Link and how maternity is just one area where people may feel that they can work together to develop an even better service for young families. Let's have a look at a great example of how Norfolk Link involvement has benefited health and social care within the county.
Most of us have visited or used a hospital at some time or other. In general, patients throughout the county receive the very best care available.
However, after some concerns were raised, Norfolk Link decided to conduct a small survey on the experiences of patients as regards to the discharge processes at the three main hospitals in Norwich, Great Yarmouth and here in Kings Lynn. Now this is Terry. Hello Terry, nice to meet you.
Hi.
Now you are one of the volunteers for Norfolk Link.
Yes, yeah.
So Terry, why and how did the discharge survey first come about?
Well, we knew from talking to our members that people's experiences of being discharged from hospital, particularly if they needed some help or support at home, varied tremendously, both between the hospitals and within the hospitals themselves. Not surprisingly, we found that their experiences differed tremendously from some people who had felt that they had received a good service, that the support was in place, to others who received quite a poor service and could perhaps be discharged home with nobody to help them at all. We managed to identify a number of issues which we thought the hospitals should begin to address.
Okay, and you're also doing work around what is a good patient experience. Can you tell me a little bit about
Well, we
that?
did, because in some ways this arose from the discharge work, because health services generally frequently conduct satisfaction surveys on how satisfied patients are with the health and social care services that they're receiving. And we thought that very often these were quite worthless, because largely people didn't know what sort of service they should be getting, so could hardly comment on whether it was satisfactory or not, and asked people what the detail would be, how they would expect to be treated, and the sort of information they would expect to be given.
So can you tell me a little bit more about the Norfolk Link Strategy Group?
Yes, I've been a member of that for a couple of years. It's composed of ordinary members, so what we do is we respond to concerns from members, particularly if it's an issue which is of general concern, and we may set up a working group to look at this in more detail, because we think that in order to be influential in the way services are delivered, we have to be seen to be well informed and authoritative in what we say.
We found a number of examples as to how Norfolk Link is helping in local communities and how everyone in Norfolk can get involved. But there is more. Follow me.
Here at Helsden Hospital, Carl and Mark have a particular interest in mental health issues and service delivery in Norfolk. Carl is a member of the host team and facilitates the Adult Mental Health Working Group, and Mark is a key member of this group.
Mark, so you are a volunteer. How did you get into being a volunteer for Norfolk Link?
Well, basically, I had mental health conditions myself, and through other work I was doing for Experts by Experience and also for the National Mental Health Development Unit, I became a Link member. And now we've got our own adult mental health working group. There are many, many issues in mental health, as we all know, that need closely looking at.
You work quite closely with all the volunteers, and do you think it's a really good thing?
Yeah, definitely so. I mean, there's many ways that they can get involved as a volunteer. They can actually look through the website on the Norfolk Link website, or they can actually join up via postal applications as well.
We're here in Wymondham to talk to Shirley, a Norfolk Link member who has been very involved in the myalgic encephalomyelitis group, or if you prefer ME. The condition is also sometimes known as chronic fatigue syndrome. The ME group has worked tirelessly to help improve the services for people with ME in Norfolk and Suffolk. So Shirley, can you tell me a few of the problems that people with ME were facing?
Yes, certainly. I first learnt about this condition in the late 1970s, and so I was absolutely horrified when people, sufferers, their carers, came to Links about 2 years ago and said that they weren't getting a service. So we started to look in to see where it had gone wrong, and I found that it should have been a consultant-led service with 2 GPs who looked after the medical side, and then there were other members of who made up the team from the nurses, OTs, physios, etc. And that wasn't being done. We persuaded the health service to set up a panel. I'm on it as the Links member, and we have representatives from Norfolk PCT, Suffolk PCT and Great Yarmouth and Waveney PCT, because they are the ones who will provide the service. And what is now going to be put in place is an extended service. First of all, it will be led by a consultant, and one will be contracted as soon as is possible. And as well as that, the service at the moment is only based in James Paget Hospital, and it's been agreed that there will be 2 further services based in Suffolk and 2 others in Norfolk, and that is a great improvement.
You can get involved with Norfolk Link on any level that suits you. We've met Terry, who is on the strategy group, and members who are on specific groups which interest them. let's go meet Esther, who is herself a volunteer, and find out how she has been getting on with Norfolk Link. Okay, so Esther, why did you feel the need to become involved with Norfolk Link in the first place?
About 12 years ago, my mother died of neglect on a hospital trolley in another part of the world, and I was determined that that should not happen to other people. And I joined what was then the Community Health Council. It later became the Patient and Public Involvement Group, and that went into what was Link, which actually covers both health and social services now.
Okay, and did you find it easy to get involved?
Oh yes, very, very easy. I had an interest, I just joined. Always somebody at the end of the phone. You can ask anything. You get travel expenses, you get meals whilst on duty, you get taxi fares, because I don't drive, so I get taxis if I need them, and there's childcare help as well. So every opportunity is given to you to be and do as much as you want or as little as you want.
Okay, and if I wanted to get involved, how would I go about it? What would be my first step?
Well, you'd have to have an interest in health and social care issue, because you'd want to be able to make a change, but then you just apply, go on the website or email or telephone. You get an application form which is very simple to fill in. It lists your interests, and from there you'll be directed to the various groups and activities that we have that will cover that particular interest.
And you enjoy being a volunteer then?
I absolutely love it, because it's given me all sorts of insights and it's given me skills. I get the opportunity to visit and monitor all hospitals, the acute hospital, the mental health care hospital, the community hospital. I get to go to GP surgeries, and with all this information I can go back to the commissioners, who are actually the buyers of the services, and say, I think with others, if you did it this way, it would make a difference to the public, and they do listen. So I can honestly say that you do make a difference.
This has been a very brief overview of the work and how and why you might want to get involved in Norfolk Link. If you really want to make a difference, please get in touch.